Good morning. My name is Felissa Goldstein. I'm a child psychiatrist. I work at Norton Healthcare and U of L. I have been seeing patients with developmental disabilities since about 2006, and I started doing telehealth actually even earlier than that. Actually, I kind of feel like I'm coming home because I actually, learned how to do telehealth at UK during my residency and fellowship. So this is kind of fun to get to present on telehealth here. I have done probably, at this point, probably over 3,000 telehealth appointments, the bulk of which have been patients with developmental disabilities. The project that I'm going to talk with you about, or the information that I'm going to share with you, actually came from a joint project from the Telepsychiatry and the Autism Committee of the American Academy of Child and Adolescent Psychiatry. So I wish I could take all the credit for all of this, but I really can't. There was a whole team of people that were working on this, but I feel like all of us feel like it's important to share this to ensure that families with patients with developmental disabilities are able to have positive healthcare experiences, even via telehealth. So I am a consultant for Alliant Healthcare, which does a lot of work with Georgia Medicaid. So I'm going to use a patient example as a way to kind of set a scene. And of course, names have been changed to protect privacy. And this is probably more of an amalgamation of patients. Tom is 17, in high school, has autism, tardive dyskinesia, mixed receptive expressive language disorder, seizures, and migraines. He has a history of aggression, headbanging, and actually biting of other people, even recently. It's one of the few patients that has, or one of the patients has my cell number, and I've actually gotten pictures of bite marks on mom. Very picky eater, weighs over 200 pounds, lives at home with parents and older brother. He's on multiple medications, primarily managed by me and his neurologist. He uses a communication device and also speaks some single words and phrases. He attends high school and is in special education, loves school, and mom has even sent me pictures of him participating in band. Dad does have to use FMLA to be at home when Tom has his aggressive episodes. And mom also does not like to be home alone with Tom. Either dad or siblings need to be present. So what does Tom and their family need in order to be able to do an effective telehealth appointment? So the first thing, and some of these feel like they're very obvious, but at the same time, having done as many telehealth appointments as I have, it's kind of amazing where people try to think that it's okay to do a telehealth appointment. But anyway, you need a quiet place with good lighting and comfortable seating. I've had patients do appointments in restaurants. We get a lot of appointments in cars. At least the car is private. But Tom must be in a state where I am licensed. I have to confirm their phone numbers in case there's an emergency. You also want to make sure, and this is very important, especially for patients with neurodevelopmental disabilities, you want to make sure that they've eaten, that they're toileted, and that they are taking their medications as normally scheduled. Sometimes I have patients who come into the office and the parents are like, oh yeah, I didn't give them their medications this morning so that you would see what they're really like. Well, that makes it 4 times as hard to conduct an effective appointment. I trust you that you're describing to me the accurate description of your child. And if I start to have questions, then later maybe I would ask you not to give them their medication. I want to make sure that I'm aware of how Tom communicates. First of all, does Tom even communicate? Because I do have some patients that don't really communicate much at all. And if we need an interpreter, making sure we have the interpreter, but more commonly, making sure that they have whatever communication device that they use, making sure that that device is with them and charged and available to use. Again, a very simple thing, but it's amazing when I've had patients who come to appointments that use devices, they don't bring the device with them, or it's not charged. In either case, the device is useless. I want to ask the family to try and keep Tom on the screen as long as possible. observation is really a lot of what I do, especially with some of my lower functioning patients, observing them interact with their family members, observing them just doing the things that they like to do. I also encourage families to utilize the rear-facing camera on your phone, so that way the parents can talk to me, but I can also still see the patient in the background. Also want to encourage the patient to communicate. I've had patients type appointments. I've typed during appointments when they don't want to speak, but they will type something. Any way I can to get the patient to engage with me. Because there's a lot of communication that can occur between a patient and provider, even if the patient can't speak the way you and I would normally expect to speak. I also often will suggest to families, or families sometimes seem to do this naturally, that they have two caregivers accompanying the patient. One mainly provides the history and the information as to what's going on, and one whose job is more to, I don't want to say manage the patient, but help maintain everybody's safety. You want to be very aware of what Tom's triggers are. What makes him get overstimulated or emotionally dysregulated is the fact that my office, if you pick up the ambulance sounds in the background of my office, because I'm right above the emergency room, does that distract them enough, or is it loud enough for them to even hear it, that could get him dysregulated? Or my other patient I have who is fascinated with ambulances and would love it every time he hears the ambulance sirens go off. You want to ensure that the family uses their typical calming routines or have access to the patient's typical calming routines. Things like weighted vests, headphones, anything to help, dimming the lights. Also, if Tom were to become unsafe or seem like he's getting dysregulated, giving the family permission to take Tom out of the room is also okay. So what are the things that I can do as a provider? So first off, you want to maintain a calm background for the patient, both behind me and also me what I'm wearing. Like this dress probably would be a little distracting for some of the patients because of its vibrant patterns on it. So solid backgrounds, you want to have an empty, as much as you can, simplify your background in your office when you're seeing the patient. Keyboard noises or any other noises can really magnify what goes on during appointments. I've had to do a few telehealth appointments during fire drills, and I'm always hoping that the alarm will shut off really quickly, because even though my office door is closed, it's still very loud. You want to also be mindful of distracting body language. Things like excessively moving your hands or moving objects in your room. Like if you have a ceiling fan going and that movement can be distracting to somebody. Or I remember one of the first times I learned about telehealth, somebody had told the story of how they couldn't figure out why the patient kept looking both ways. And it turned out the patient was looking both ways, back and forth repeatedly, because the doctor's cat was walking behind them during the appointment. So I try to maintain eye contact with Tom or Tom's family, but preferably with Tom, as much as I can and to the degree that the patient feels comfortable. I oftentimes have Toms that don't want to make eye contact. I encourage them, I really ask the families to have the patients at least be on the screen for at least a few minutes so that I can do things like look for abnormal movements or any other unusual physical findings that I can't tell if they're off the screen. I also will explain to them, because I typically have a 2-screen setup, I will explain to them if I'm looking the other way, it's because I'm looking at the medical record. Also, ensuring that everybody knows who's in the room. So I very commonly have medical students and residents with me. So making sure that everybody understands, it's usually the first sentence out of my mouth, I have a such and such with me today, is it okay if they sit in with us? So that way the family knows everybody who's in the room. Also, for teens or adults, you might have to encourage them, if they wanted privacy, to either ask their family to step out if they're if they can provide their own history and background, or having them switch locations. I've gone on many a tour of people's stairwells and things as the patient is moving to their bedroom or a more private place. Headphones can also increase privacy. AirPods also are pretty common. Also remembering that I, as a provider, telepsychiatry can be tiring for the family and the patients for a long visit. So also trying to keep in mind that I'm not always going to get everything during the single appointment, that sometimes it's okay if I have to wait and get information on something during the second visit. I will obtain my mental status exam first, because the patients may not stay on the screen for very long, and in addition, observing their behavior first. Also, I've had families where the caregivers will will videotape patients' behaviors or unusual things that they want me to see that I can visualize even before the appointment. And I say this always, that even minimally verbal patients can provide me information. I've had some great nonverbal interactions with some of my patients who don't say anything at all. During the interview, you want to ask about any new difficulties or challenges that the family is having, especially in our current political climate and general climate of the country. Things are constantly changing, and it's always important to check in with the families and see how their routines and their lives have been changed. Like, I know Medicaid cuts are a big concern to a lot of my patients. I want to be very sensitive to the patient's developmental level. The person who's 17, who's at a developmental age of 5, I'm going to approach differently than the 17-year-old who's at the developmental age of a 17-year-old. This is an opportunity to provide psychoeducation, and I want to make sure that this is the opportunity for the family to express any and all of their concerns. You want to be creative and be flexible. You can share your screen and you do doodling, or you can play tic-tac-toe. I've played peekaboo, I've played hide and seek. You can deliver interventions via telehealth. Things like reading a social story, sharing a video clip, sharing a meme, or watching a film. Asking the patients to show you their favorite objects or their favorite toys, or inviting them to give you a virtual tour of their bedroom, or you giving them a virtual tour of their office and then having them give you a virtual tour of their room. And then these are the handouts. These are some handouts. These are reference sheets that have all the different tips and things that I've mentioned today. Thank you so much for your time, and this is my contact information if anybody has any questions.